Hello, my name is Dr. Adam Kelly. This is an example case from the Acute Illness Programme delivered to final year medical students, which focuses on creating an interactive, challenging learning environment to increase knowledge and confidence in common acute illnesses, which the newly qualified doctor may be expected to manage. Here I will attempt to guide you through how these cases are delivered. Each slide drip feeds information on a particular presentation, which an individual is then asked to interpret and suggest the next step in management as the case progresses. Once the individual is given these steps, the group is encouraged to make any additional points or ask questions to clarify any issues as we go along. Each case focuses on a particular complaint, but the course as a whole is designed to cover all common investigations, examinations, and procedures the newly qualified doctor may be asked to request or interpret, as well as encouraging learning on things that are traditionally picked up on the job, such as commonly used acronyms and medication. So, let's begin. Each case begins with a slide on the presenting complaint and the patient sitting in front of them. The first person in the group will be asked to interpret this information and ask what pertinent history is needed to elaborate upon the initial presentation, in this case, feeling shortness of breath. Once we have this, once the first person has answered these questions, the group is asked to comment or give any advice to the individual, or to ask any questions themselves, needing to clarify any points. Once this has happened, we can move on to the next slide and drip feed that further information. We then ask the next person in the group to interpret this new information, and then ask them how they would like to proceed, what diagnosis they suspect, and what questions are needed to advance our history and advance the management of the case overall. Once the person has answered, the group is encouraged to comment or ask any questions. We then continue to drip feed information about the history of the presenting complaint, again asking the next individual to interpret what have been told, and then what other important parts of the history do we need, and also where we might get this information. Once that person has given their opinion, the group is, as always, encouraged to answer any questions. We then move on to the rest of the history, focusing on past medical history, drug history, allergies, family history, and social history. We'll then ask an individual to interpret these as we have in previous slides. This is an important point in the Acute Illness Programme, that across all the cases we try and include all common past medical history and acronyms which the student may be expected to know on the first day, but may not have been taught specifically. In this particular case, MI, myocardial infarction, CCF, congestive cardiac failure, OA, osteoarthritis, hypertension, and chronic kidney disease. We then also include a large range of commonly used medications, making sure that each individual within the group is aware of all acronyms and all medications used in every single case. After this point, we ask the next person, what are you going to look for examination, looking specifically for the points in examination and the signs that you want to see given the history of presenting complaint. The next person will then be asked to interpret the observations and findings on examination, explaining what each individual point means and how it is relevant to the presenting complaint. We then move on to the investigations. We ask the next individual, what investigations do you want and why? An important point is asking people to justify these examinations, as this increases learning, understanding, therefore increase confidence overall. In this particular case, the first investigation we offer is an ECG. We then ask the next individual to interpret and present this ECG in the style of a clinical examination, thus increasing confidence in their ability to interpret with feedback from the presenter, but also useful for presentation in final exams, which, given they are final year medical students, will not be too far away. Then move on to the next investigation, a chest x-ray, in this particular case showing signs of congestive cardiac failure. We'd ask the next person to interpret, present this in the style of a clinical examination, and then offer feedback and pointers to the individual and the group for presenting chest x-rays to an examiner. With every case we include blood tests and ask the next individual to interpret these, importantly without reference ranges, as this encourages the group over the 4 2-hour-long sessions to learn the reference ranges themselves, and then overall increase confidence in interpretation. In this particular case, we look at arterial blood gas as well. We ask the person to interpret this, again without reference ranges, encouraging people to learn the reference range themselves and increase confidence. In some investigations, there's a key piece of information which is needed, such as in an arterial blood gas, it would be what oxygen the patient is on. We often withhold this information until the student is able to tell us what it is, thus showing the challenging learning environment. At this point, we'd ask the group for a diagnosis, and in this case, exacerbation of congestive cardiac failure with atrial fibrillation. We then ask what the management of congestive cardiac failure is. We split in all cases in the acute illness programme. We split into conservative, medical and surgical, and initial and subsequent, focusing on the initial management, as this is what the newly qualified doctor will be mainly expected to do. When we look at initial management, we will ask the individual what they would like to do from a conservative and medical, and if necessary, surgical point of view. In this particular case, we go through it, focusing on important points such as furosemide for rapid action, however titrating to blood pressure. Then turn to the next individual, what is the next step in management. Further management is something that is not for the acutely ill, but given that we are going through congestive cardiac failure, it's wise that the individual has a complete knowledge. And then again, what medications, this is chronic management, but increasing overall knowledge and confidence in the participants. We also note that in this case there is also atrial fibrillation, and therefore we will also look at acute management of atrial fibrillation, asking the next individual group to tell us what the acute management is, and then before going through it with key information in bold and highlighted. Moving on to chronic management, and then follow-up. In each case, we offer a summary at the end to go over the key points, as well as summarise knowledge and solidify learning. At this point, the group is encouraged to ask any questions about either the case or the presentation before we can move on to the next case. Overall, the acute illness programme is designed so that the final year medical students can learn to apply their knowledge which they've learned in final years in a challenging, pressured environment, as they may find on their first on-call as a newly qualified doctor. Thank you for listening. If you have any further questions, I will be by my post at the times advertised. Thank you very much.